Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us once again, Rob Leake. He is the Executive Director of Hospital Services and the Director of Financial Operations. Welcome, Rob. Thanks for joining us today.
Thanks for having me.
It's wonderful to have you. We're very excited to have you fill us in on a project that has been underway at Masonicare Health Center, and that is the expansion of our acute behavioral health hospital there. We'd love to hear all about it.
Yeah, thank you. We are equally excited. We received CON approval beginning of this year, and we have actually started the construction. It was in March, I believe. We got the okay from all the local officials to convert the 14-bed Worcester 4 unit into 14 additional behavioral health hospital beds. Also on that unit, the expansion will enable us to expand our current service offering to include treatment of individuals with the dual diagnosis of substance abuse. That's something we've not been able to do. We know that need is out there. It's been a need that has been unmet up till now. We've heard a lot from the local emergency rooms that there's this continued growth in that comorbidity. So without having this special unit, we weren't really able to mix folks with that comorbidity with the general behavioral health population. This will enable us to do that. So again, we are very excited to be able to expand this offering. We are hoping that the unit will open, as it looks right now, it's beginning of September, mid-September. So we are anxiously awaiting.
That sounds wonderful, Rob. And JP, this is a really important piece of our continuum of senior care, having these expanded behavioral health services that we can offer.
Yes, Sandy. With really our system, we have really identified areas where we need to look at expanding, and we've looked at some areas where we need to look at potentially shrinking. And this is all part of our strategic plan that we've had in place for a few years now. And thanks to Rob and his leadership on pushing forward our behavioral health hospital, we've really been able to capitalize on where we see a significant need for our seniors throughout our system. And because of that need, we've been able to go to the state and really ask for these additional 14 beds. And so everybody knows this is a pretty important step for Masonicare to be able to do this. We've had a lot of support from outside organizations looking for us to do that, but we've really looked internally to say, is this the right thing for us to do, recognizing that many of our residents are in need of these services. And because of that, these 14 beds will allow us to continue to good work that we do each and every day. And it allows us to stay true to our strategy and our mission of really addressing really what our residents truly are looking for, and our professional referral sources are looking for. So, I'm very happy that we're able to do this. This behavioral health floor, I think, will also be something that all of us can be proud of. And I want to thank Rob. I want to thank the entire behavioral health leadership and staff for everything they do each and every day. Those rooms or those beds are full essentially every day. And to add these 14, we're expecting them to also be full. But ultimately, it's our staff that are delivering on our promise. And I want to thank them for everything that they're doing to allow us to grow on our strategy. So thank you, Rob. Thank you to your staff, and thank you to everyone, because again, this is something that we can't do without all of the great work of our staff and our residents who are desiring for this to happen.
Thank you, JP.
Absolutely. Thanks to you both for the wonderful update. And we turn now to the latest news on the coronavirus. Dr. Schwartz, as always, we look to you. The rise of COVID cases across our country is being largely attributed to the Delta variant. Can you share the latest information with us?
Definitely, Sandy. Every time we do these shows, and I think we're up to 30 or 32 now, I've lost track, but there's always something new to talk about with COVID. But I did want to just welcome Rob. Rob and I served on many different committees together, MedExec and the Coronavirus Task Force Committee, and we've had a lot of laughs together. But this looks like a great expansion, a great program. I've always loved, the work done in GMPP, especially being a geriatrician. So I think this is going to be fabulous. So I'm glad to just see it happening. Mm-hmm. So having said that, let's turn to COVID now. And I actually synthesized 2 articles into one. So I'm trying to condense this for you, but there's a lot of information. And the main article, the title is Delta Variant is COVID-19 on Steroids, experts say, with cases increasing in nearly half of US states. So you can see this is becoming a significant issue. So I'm going to read some of this and give you some expert quotes as well, so you can get sort of the standard of what's happening now with Delta variant. So they say 24 states have seen an uptick of at least 10% in COVID-19 cases over the past week. This is data from Johns Hopkins University. And they say, health experts and federal government keep pressing for more people to get vaccinated. And the rapid spread of the Delta variant of the coronavirus only increased this pressure. So you remember we talked many times before about the coronavirus being an RNA type of virus, and being an RNA virus like the flu virus, it mutates. And the sort of the key point where the mutations occur is the spike protein. And here they see like in the Delta variant that it makes it more sticky, more adherent to cells, and that's why it's more transmissible. So, just to get some background information, this variant, the Delta variant, was first identified in India, and it accounted for 51.7% of all new COVID-19 infections in this country over the last 2 weeks since last Saturday. And this is from data from the CDC. And the variant, if you like fancy names and things, they've also named it B16172. As I say, was first detected in India. And I'm going to give you some statistics about different states. So it makes up more than 80% of new cases in some Midwestern states, including Iowa, Kansas, and Missouri. And it's also 74% of cases in Western states, such as Colorado and Utah, and 59% in Southern states, such as Louisiana and Texas. So this is a pretty significant situation. So this is a quote from Andy Slavitt, and he was actually a former senior advisor to Joe Biden's COVID response team. And what he said is, we should think about the Delta variant as the 2020 version of COVID-19 on steroids. It's twice as infectious. Fortunately, unlike 2020, we actually have a tool that stops the Delta variant in its tracks, and it's called vaccine. He also says for fully vaccinated people, the variant presents very little threat to you, very unlikely that you're going to get sick, he said. So these are kind of the take-home points. Communities with low vaccination rates are bearing the brunt of new Delta cases, and public health experts are urging those who are unvaccinated to get a shot to protect themselves and their communities against future surges. So this is a quote from a physician. I quoted him before, Paul Offit. He's an infectious disease specialist at Children's Hospital of Philadelphia. And he said, right now we have 2 Americas, the vaccinated and the unvaccinated. We're feeling pretty good right now because it's the summer, but come winter, if we still have a significant percentage of the population that is unvaccinated, we're going to see the virus surge again. So sort of in conclusion, health officials are also watching for other variants that could evade vaccine protection. So as if we don't have enough with Delta, now we're getting into Epsilon, which will be a future topic I'm sure we'll talk about. But at any rate, so that could lead to major outbreaks this year. But I think the main take-home point so far, according to data that we see, the COVID-19 vaccines appear to protect people against the Delta variant. But one final piece of statistics that Sandy and I talked about earlier, 99.5% of COVID deaths occur in unvaccinated people. So that's very significant, and it's something to reinforce the importance of vaccinations. So now comes the moment of truth, my inspirational quote for the week. I just like this quote, that's why I picked it, but it's very short and simple. It is better to be a lion for a day than a sheep all your life. So I like that quote. And it actually came from Sister Elizabeth Kenny. And if you don't know who Sister Elizabeth Kenny is, she's actually a self-trained Australian bush nurse who developed a new approach to treating victims of polio. She actually did sort of a hands-on early physical therapy manipulation. And just a little bit of additional trivia, she actually had a movie about her called Sister Kenny. It was in 1946. It was on one of the oldie shows recently, and Rosalind Russell starred in it. So just in case, now you learned something from me today. So anyway, I want to thank everybody for everything you do, for all your dedication, hard work, getting vaccinated, good health practices and so forth, what has to continue. And once again, every week I try to wish everybody health, and I wish you peace. Thank you.
Thank you so much, Dr. Schwartz, as always. And I want to thank all of you for sharing your time and insights with us today. And thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.